Hi everyone, my name is Sefakor Komabu-Pomeyie and I'm the Director of Diversity, Equity and Inclusion and also a lecturer in the College of Nursing and Health Sciences. I'm highly delighted to invite you to this new course called Apply Leadership in Health Equity, which is actually one of the core requirements of public health, equity, and advocacy that I'm creating. And this is a course that is very much unique. Why? Because I will say that we are trying to use a lot of frameworks which are very much practical on the ground, and also grounding the student to be who they are and be also there for their patients. I will quote one of the experts in the public health framework, which is accompaniment of Paul. In other words, Paul Farmer's accompaniment framework is so much grounded in this particular course to empower the student to be able to build community, to be able to connect with their people, to be there for them, not just for a minute of writing prescription for them, but to take them through their process of healing, their process of growth. At the end of the day, the journey that they are going through, they have to be part of them in all their lifestyles. In other words, this framework, it's more of community building. I think Paul Farmer's framework of accompaniment is what I would say is coming from my ground or my foundation, which I would say that it's a community building environment, which we call in Ubuntu framework. And when I look at it critically, is definitely the same thing that Paul Farmer has been talking about or have been using, because this is a framework which actually does not privilege technical expertise over compassion or collaboration or partnership. It helps you to grow in all those fields of work with the patients that you are working with.
Paul Farmer said, all humans are human, meaning that no person in this world has any characteristic about them that deems them less worthy of getting the highest level of care as any other person.
And I'll be so glad to have you in this class, especially to deliberate, to reframe, and to just make sure that we are trying to solve the problem, build that community of humanity, and solve the problems that are ahead of us in order to acquire that equity in health or equity in public health, and maybe able to also advocate for the people, with the people, because that was one major piece of this accompaniment framework, because it was able to be there for the people and advocate with them, but not for them.
This class is important to me because it's teaching me not only to be a better listener, but also a better advocate. And I would say that both of those are allowing me to be a better version of myself. And what this allows me to do is move through the world understanding how to make my life better, but use that to improve the lives of others.
I feel like this class will teach you not only about the importance of health equity, but also deepen your sense of empathy and spark a craving for justice. At least it did for me. I have always been a very empathetic person, and I feel like this class has really taught me about what it means to truly look into other people's lives and see how other people are living and feeling, and the implications of those things across their lives, and how our lives are not just about us, they're about everyone around us. And I think this class has really given me a space to see that.
But also to build families, not a team. So we are able to build families around the job that you are doing, and also that will take you far even after your work experiences. So I hope you will join us in this class so that we can deliberate together, build support for each other, especially which is actually building our own emotional well-being. Thank you so much.
This class has created a family for me. I love the professor, I love my classmates, and I truly am able to go to class just being excited to learn and excited to learn how I can use the teachings in my life.